Every year, 6.6 million children under the age of 5 die worldwide. This means that each day, 18,000 children die. These tragic numbers are shocking, but are made even worse by the fact that most of these deaths are preventable. Over half of the yearly deaths are due to severe malnutrition. Other leading causes of child death include diarrhea, malaria, pneumonia, and premature births. As can be seen on this graphic, the countries in red, orange, and yellow are regions with the highest rates of child mortality and are primarily found in sub-Saharan Africa and Southeast Asia. Right now, the 3 countries with the highest child mortality rates are Afghanistan, Mali, and Somalia. There is no single cause for the high global rate of child mortality, but poverty is a primary factor. Poor children are 3 times as likely to die than wealthier children. Lack of clean water and sanitation also leads to diseases in babies and mothers. Poor sanitation during births can cause infant death. Lack of education can lead to child mortality. When women receive some level of education, even just primary schooling, their children are more likely to live. And in war-torn areas, there are higher rates of child mortality as well. The problem of child mortality is so important that the United Nations have made it a millennium goal. Some important examples of people helping are UNICEF, the World Health Organization, Living Goods, and Project Peanut Butter. UNICEF is an organization that works in 190 countries to improve the lives of children through programs that provide the children with clean water, nutrition, education, emergency relief, and medical care. Thanks to polio and measles vaccines, it is estimated that over 10 million lives have been saved. The WHO promotes health in the United Nations system. It gathers data regarding all global health issues, including child mortality. It helps governments create health standards and provides guidelines on how to eradicate diseases like TB and malaria. And the WHO promotes vaccines. Living Goods is a non-profit organization that supplies affordable products to needy families in rural villages in Uganda and Kenya. The company creates sales forces made up of local villagers who go door to door bringing items like medicines, mosquito nets, and healthy cook stoves to the families that need them. Project Peanut Butter was started by Dr. Mark Maneri to help treat severe acute malnutrition. The majority of children suffering are found in sub-Saharan Africa and Southeast Asia. Dr. Maneri went to the country of Malawi to figure out what works best to treat malnutrition. He came up with an affordable formula that is mostly made out of peanuts. It is simple and easy for mothers to use, and it doesn't spoil. It is estimated that his project has already saved 800,000 children. Little Lalifa was suffering from malnutrition. 6 weeks later, she was a healthy baby from using the formula. Young Pili Rani came to the clinic suffering from edema or swollen legs due to malnutrition. After using the formula for 6 weeks, his edema was gone. And now, he's a happy little boy. We need to put ourselves in these kids' shoes, look at their photos, and realize they are kids just like us. Each of us can make contributions that can go a long way. We can spread awareness. And instead of spending money on something we don't really need, we can buy a child a mosquito net to protect them from malaria, or pay for a vaccine, or help educate young mothers. Maybe we hold a fundraiser at school, or put aside part of our allowance. Maybe we ask our friends for donations instead of birthday presents next year, or ask our parents to make donations as Christmas or Hanukkah presents. 18,000 children around the world are dying every day of preventable causes. If we choose to look away, the problem will remain. This is a battle that needs to be fought on many different fronts. If we can land a man on the moon, it seems we should be able to reduce child mortality. I don't know about you, but I think we should all make this a global priority.